Hello, everybody. My name is Alex Joseph Foote, and I attend the St. Louis College of Pharmacy. If I wasn't a pharmacist, growing up, my life was constantly consumed with sports. The majority of my free time was spent either on the soccer or baseball fields. In addition to playing sports, I spent hours officiating youth soccer across the state of Kentucky. Being a native New Yorker, I'm an avid Yankees, Jets, Rangers, and Knicks fan. Having the passion I have for sports, if I wasn't a pharmacist, my aspiration would be to become a sports announcer. Strengths and areas for improvement. The following strengths come from StrengthsFinder, which is a quiz that is used to determine your strengths. My first strength is that I'm a woo, which stands for winning others over. This means that I enjoy the challenge of meeting new people and building a relationship with them. Building this relationship allows for patients to trust me, which also allows for me to gain more information and to better treat them. Another strength of mine is that I'm an includer. I like to expand the group to benefit from their support. Regardless of race, sex, nationality, personality, or faith, I cast few judgments. This allows me to always think that all of my patients are equally important. Moving on to areas for improvement. My first area of improvement is that I'm a chatterbox. Since I'm a woo, there are times that I find myself talking to my patients for longer than expected. Sometimes I do find it challenging to cut off a patient when a conversation gets completely off topic. Another area of improvement for me is time management. I tend to focus on patient interactions at the window or on the phone and need to prioritize other needs in the pharmacy, even though it's not a direct patient care task. After speaking with residents in this program, I'm excited to build on this skill and improve my efficiency. Greatest accomplishment. My greatest accomplishment outside of pharmacy school was working with the Leukemia and Lymphoma Society and raising over $5,000 during my time at the St. Louis College of Pharmacy. Throughout school, I helped host many different fundraising events. The first one being a trivia night, which we held at a local bar. Another fundraising event that I helped organize was the St. Louis College of Pharmacy Tumbler fundraiser, as well as the St. Louis College of Pharmacy ID Badge Reel fundraiser. Favorite movie. Overall, there are many movies that I really enjoy. My favorite movie of all time right now is The Greatest Showman. In my opinion, this movie has an outstanding soundtrack. The story of P.T. Barnum is truly inspiring. He begins his life with absolutely nothing but a dream. He works through adversity to become extremely successful just to get caught up in the fame and fortunes. At the end, he eventually realizes it's not about the fame or fortunes, but the people that support you. Biggest pet peeve. Personally, my biggest pet peeve is when providers and coworkers pass judgment prematurely and don't get time to know their patients. This could negatively impact the quality of care that our patients are receiving. Hobbies. So I have many different hobbies. The first one is playing sports or attending different sporting events. There are a couple pictures up here of me at a baseball game, at a football game, and at a hockey game. I also enjoy attending live theatrical performances. So the last play I went to see was at the Fox Theater in St. Louis. We saw Wicked. I love traveling both domestically and internationally. I really enjoy experiencing other cultures and learning different cultural differences. And then a unique hobby of mine is brewing beer. There are a couple peers through school that we started brewing beer on our own. So it's something unique about me. Three words my best friends use to describe me. So for this slide, I did go out and text a couple of my peers to see what they would say. My fiance, Jessica, said I'm outgoing, charismatic, and empathetic. Eric, who's a peer from pharmacy school, said I am loyal, dedicated, and have a positive mentality. Justin, who's also a peer from school, said I am charismatic, motivated, and energized. A patient that has impacted me. During my community pharmacy rotation, I was dispensing a new glucose meter and supplies and new insulin therapy to a patient. After asking the patient if they had any questions, I realized that they were very hesitant and replied, I don't think so. Since the patient was very hesitant, I asked if the doctor showed them how to properly use their new glucose meter, how to understand the readings that the glucose meter would give them, and how to properly inject their new medication, which then they replied, "No, this is all new to me. The doctor didn't really tell me anything." After hearing the doctor didn't counsel them on anything, I took the time out of my day to sit down with the patient and counsel them on how to use the glucose meter and how to properly read and understand what the glucose levels meant. So we took the time to open the meter, test his blood sugars, to show him how to really use it and what his reading meant. We also then discussed his new insulin therapy. We showed him how to inject his insulin, as well as how to rotate injection sites, where to inject, and what the reservoir should look like to make sure the insulin is still good. After spending time with this patient, I felt confident that I was able to help them understand everything. The patient was very appreciative of me for taking the time to make sure that they felt comfortable with their new medications before going home. This patient made me realize the importance of what we do as a community pharmacist every single day. As a community pharmacist, we are the last line of communication between patient and healthcare professionals before they go home with their medication. So it is important that we make sure that they understand what their medications are, how to properly take them to ensure that they get the best possible care and that they are properly adherence to them. Why residency? I chose residency to help improve my clinical knowledge. I always feel that there is always room to grow, and a residency is one of the most impactful experiences a pharmacy student can transition into to continue to grow their clinical knowledge. I also chose residency to improve my knowledge and gain a better understanding of all aspects of community pharmacy and specialty pharmacy. I've worked at the University of Louisville outpatient pharmacy since I volunteered there in high school and then as a tech for 7 years now. And just every chance that I've had, I've enjoyed learning about the different ins and outs of community pharmacy and specialty pharmacy. So I would like to improve my knowledge on that. Another thing that I would like to improve during residency is my thought skills as well as time management skills. I appreciate you taking the time to watch this presentation, and I look forward to meeting you on Thursday. Thanks. Have a good one.